good to have you with us in the 9 p.m. edition of the Urban Debate. Tonight, we're going to focus on India's vaccine policy, the ground reality versus what's on paper and what should the governments really be doing. But before that, let me get you a few reports to show you what's happening on ground. And from Patna all the way to Jammu, the story is the same. Some confusion, large amount of crowds, vaccine shortage, all of that continues really on ground. As India opens up its vaccination to the 18 to 44 year age group as well, multiple cities are seeing long queues and delay in the vaccine drives. In Bengaluru, the COVID drive was delayed after the Neta came late for inauguration for phase 3 drive. In some other cities, people have been flocking way earlier than what their slots are because there is so much apprehension of what's going to happen. I want to start off by first bringing you this report from Patna in Bihar. Huge crowd was seen at the new Gardiner Road Hospital COVID Center. This is one of the VVIP areas in the city, if you're aware of how Patna is. While there was not a single official present at the center to manage the crowd, a local was quoted as saying that people have been coming early to the center due to lack of information. Take a look at this report.
This was the Gardiner Hospital in Patna. A large number of people had come for the third phase of vaccination, which started yesterday. Now, since it was this vaccination for those above the age of 18, and a large number of people had registered, but only 100 people were vaccinated. And that was the reason why a large number of people had assembled there. But it was said that only 100 people would be vaccinated and the rest would not be vaccinated, which led to utter chaos at the center. But certainly this is nothing new. Even in the past, we had reported stories from the same center where a large number of people come and stand very close by, flouting the lockdown norms. There are no one from the hospital staff or any health worker or anyone from the district administration controlling the people there. People themselves have been complaining that this exposes them to the threat of COVID, because you never know that in the crowd some people may be positive or some are asymptomatic, and certainly that is risking everyone present there. So this shows this condition of the health sector here in Bihar. Apart from these, even the hospitals on which we have been reporting shows that there is complete chaos, and in almost all the hospitals there are no proper beds. People are being forced to carry the patients on cart because of absence of ambulance. Patients are not getting oxygen time, leading to so many deaths at various places. So certainly this exposes the health infrastructure here in Bihar. So it also speaks about the sorry state of affairs. And as far as the vaccinations are concerned, let me tell you that vaccination at the private hospitals have closed, and this is leading to mass gathering and huge crowd at the vaccination centers where this vaccination drive is going on.
We had a story that came in where vaccination drive got delayed because the corporator didn't land up on time to inaugurate the center, and so the people had to wait for us. But these ground stories aside, there is a bigger issue here, which is about the confusion about who needs to go where, who needs to supply what, and when are they going to get the vaccines. We told you viewers how, because of limited stocks in Mumbai, for example, the system is that the BMC every day announces when they will open the slots for booking every day, and those slots finish up within a few minutes, of course, because they are limited slots. In other parts, there have now instances emerged where people go to the vaccination center and are then told to take a token, go back and come back again basis their token number. We've had ground stories emerge now that show that in one ward in Mumbai, they refuse to give you vaccination if you are from another ward because the vaccines are in shortage. We've now had a story today coming from Uttar Pradesh that actually shows contradiction within what the government's own policy is. A May 7th order from Uttar Pradesh actually said that you will need address proof to be able to get a vaccine shot. It's a very detailed order and it's very clear about what is required. Today, the Uttar Pradesh official fact check Twitter handle says this is a misinformation campaign. When questions were asked, the state health minister also said that everybody will be registered. But imagine the confusion it creates on ground. Imagine then what happens at the vaccination centers. Yes, I can give my ID, which will also have my address proof. But can that become a basis for me getting the vaccine anywhere in this country, irrespective of where my domicile is, irrespective of which part of the city I live in, where I go and get my vaccine? Shouldn't be a conversation point at all, but it has become. There are fights still happening. Today the big fight that came in was from Delhi, and the Delhi government accusing the center of choking their supply of vaccines, saying we are running short on vaccines. We only have limited days stocks. That politics continues. Amidst all of this, the government, central government, stands by its decision on the new vaccine policy that was implemented from May 1st. And that is what they've told the Supreme Court, while saying that this is the decision of the executive and the judiciary shouldn't really wade into these waters. The government says that these decisions, which are right decisions, fair for all, equitable in distribution, with a fair pricing, have actually been done based on what the experts have said. And there is nothing wrong with India's vaccine policy. Then I don't know what these reports that we're getting from ground are about. Because to me, each and every single of these reports only points in one direction, which is mismanagement, bad calculation, bad preparation, and shortage of vaccines now. All of these new rules that at the local level people are trying to create are because there is a shortage of vaccines. All of the time which is being wasted in politicking is because of shortage of vaccines. All the confusion that is happening right now and change in decisions is because of shortage of vaccines. Every day, some part of a country, new set of rules come out for vaccination because the states can decide, the hospitals can decide, the center can decide. And so we don't know who's really in charge here, ensuring that people get vaccinated. Today there's a story in the Indian Express that talks about how the supply chain is running into hurdles. Because when you leave it to the states and the private hospitals who were not prepared for it, who didn't plan for it for over a year, they're not going to be as well entrenched into the system as a central government's supply chain and cold chain would have been. So they are now on their own figuring this out, which is further impacting the supply. Do we really need all of this? India was clocking 33 lakh to 34 lakh vaccinations per day in the first week of April. We've now come down to an average last week of 17 lakh vaccinations per day. Numbers as of yesterday suggest 1/3 of that in one single day. What we've been warning for several weeks now is becoming a reality. Is there a policy change which is required is the question I'm again going to ask tonight as we bring to you these examples of chaos on ground. Let me say good evening to the panelists who are joining us. Amit Puri, spokesperson for BJP UP joins us. Charan Singh Sapra of the Congress Party. Clyde Crasto, spokesperson for the NCP. Monajit Mandal of the TMC, and Dr. Jayalal, National President for the Indian Medical Association, also joins us this evening. Let me actually begin by asking Mr. Amit Puri to clarify to us on where things stand. एक जो order release हुआ था Mr. Amit Puri by the Uttar Pradesh government dated 7th of May that made it extremely clear that residents will have to provide address proof. Now, is that order valid or not is something that the government needs to again put out on paper so that there is no confusion on ground. But before I actually go to the political representatives, let me see if I can go across to Dr. Jayalal and ask Dr. Jayalal this question. Dr. Jayalal, how does this work when the policy is different for each state? Can we really have a policy where we say that only the locals here with the address proof should be able to get vaccinated? Does it really benefit when we say that the private hospitals are now in charge for sourcing, buying, sourcing, procuring and distributing their own vaccines? Do hospitals have that kind of a bandwidth?
Yeah, thank you for this question. And absolutely, we are in a chaotic situation. We do not know what exactly is happening in this country and how far we will be able to go forward in this country. India has a rich tradition. We have eradicated polio, we have eradicated smallpox, we have ensured that by the vaccination in this country. We have ensured that there is 95 to 100% vaccination for all the children in this country. So we have a rich tradition of doing the thing. There were no chaos at any time has happened in this country at this time. But unfortunately, now suddenly there is a shift in the policy and saying the differential pricing and differential source of getting the vaccine. And this is creating real havoc for this. Though the Honorable Prime Minister has announced that from the May 1st, everyone above the age of 18 will be able to get the vaccine. But unfortunately, in many parts of the country, still it is not started, or many times the people are standing in queue for a long time and still they go in vain, and that somebody is coming and saying that vaccine is not available. I just want to ask the government, and every time the government officials, they are able to say that the Serum Institute is able to produce 6 crore or the 60 million vaccine per day, per month, and another 20 million is created from the BioVac company. So that we at least, on an average, we would have produced nearly 8 crore of the vaccine per month. Even if it is started in January, by now it is almost 4 months has gone. That means we would have had the stock of nearly 32 crores of the vaccine. But unfortunately, we have only vaccinated 17 crore. That means, there is something wrong with the data itself. Or is that the rest of the 16 crore has been exported? Or is the drug is still available in this country? See, now by any means, the Serum Institute can produce 2 million vaccine per day, another 1 million from the BioVac. We will have even a daily production. If you see, we will have now nearly 3 million dose can be prepared, but our average daily input is only 1.7. That is very horrible situation. Something wrong is happening. We do have a vaccine, but their distribution is in a chaos. Now distribution is not able to reach the private practitioners where it is more needed. And you say that only for the people from 18 to 45 will not be able to get the vaccine from the central able to get the vaccine. Now, these are the people, the laborers, the agriculture workers, the daily wages. Those people definitely need vaccine, and we need to give that. We are suffering a lot. We know for sure that only by giving a vaccine that we are going to save this country from the catastrophe. But this, and if we are not sure that how we are going forward, and we already given permission for Sputnik, and doses are now landed here, then when the distribution is going to start, nobody knows. And how we are going to give the license for other drugs, still in a confusion. When we go to the court, also there is a confusion is happening place. And I wish and I appeal to the government and the landed the administrators, please come out with a uniform policy. This is not the time for us to say a differential pricing and differential policy. The central government should take the responsibility of purchasing the drug and uniform source of trafficking this drug to the respective place and ensuring the drug is given to all the people in this country. We have adequate budget, you have allocation 35,000 crore. With that, definitely it will be possible for the government to purchase the drug and enforce that it will be able to reach the people wherever they are and whatever the place they are, they will be able to get the vaccine.
Okay, fair enough. Let me see if I can now go across to Mr. Amit Puri. Mr. Puri, if you can hear me, what is the current policy that the UP government has for vaccinating people between the age of 18 to 44?
Yeah, we've spoken to the Health Minister, Mr. Jayapratap Singh, and he has informed me all those who are being registered in the vaccination program will get the vaccine. So there is absolutely no confusion.
So what about the 7th May order? Is there a fresh order that has been released cancelling this or withdrawing this? Because I'm reading the 7th May order which says कि कोविड टीकाकरण हेतु आने वाले 18 से 44 आयु वर्ग के लोगों के वैक्सीनेशन के पूर्व ये सुनिश्चित कर लिया जाए कि ये उत्तर प्रदेश के ही नागरिक हों।
देखिए, वो एक शब्द के अंतर के कारण से मैं मानता हूं there should have been a better vocabulary and I admit the mistake. वो नागरिक और निवासी के कारण से, शब्द के कारण से यह कंफ्यूजन पैदा हुआ। लेकिन मैं समझता हूं कि अभी जब जयप्रताप सिंह जी से यूपी के हेल्थ मिनिस्टर से मेरी बात हुई, उन्होंने व्हाट्सएप मैसेज भी मुझको किया है कि एक्सचेंज विद यू, ही हैज मेड इट वेरी क्लियर कि जो भी एग्जिस्टिंग पॉलिसी में रजिस्टर्ड होंगे वैक्सीनेशन प्रोग्राम के लिए विल गेट द वैक्सीनेशन. सो देयर इज नो कंफ्यूजन ऑन दैट अकाउंट.
बट वो निवासी भी हो या ना हो, उससे क्या फर्क पड़ता है अमित पुरी जी? मैंने एक वैक्सीन अगर यहाँ मुंबई में लगवाई और मुझे काम की वजह से या पर्सनल रीजंस की वजह से उत्तर प्रदेश जाना पड़ा और मैं वहां पे हूँ, जब मेरी सेकंड विंडो का समय आया तो मैं वहां पे वैक्सीन नहीं ले सकती?
बिल्कुल ले सकती हैं, जो यूनियन गवर्नमेंट की एसओपीज है मेरे सामने है, और उन एसओपीज को उत्तर प्रदेश में भी फॉलो किया जाएगा. दीज आर दी
जी
एसओपीज.
तो फिर निवासी होने का भी कोई संबंध नहीं ना यहाँ पे. ये ऑर्डर का मतलब ही क्या था?
मुझे लगता है कि इस ऑर्डर को जारी करते समय जो शब्दावली इस्तेमाल की गई उसमें कंफ्यूजन हुआ है. आई डू एडमिट द मिस्टेक, बट मैं लेट मी अश्योर ईच एंड एवरीवन. देखिए, वो इस बीच में ये विषय आया था कि वैक्सीनेशन के प्रोग्राम के अंदर रियल टाइम डाटा भी हमको रखना है, तो उसमें उत्तर प्रदेश के कितने नागरिकों को वैक्सीनेट किया गया ये भी डाटा रहना चाहिए. उसके कारण से बीच में उसमें कुछ डिस्कशन था जिसके कारण प्रॉब्ली ये कंफ्यूजन अराइज किया. लेट मी मेक इट वन मोर टाइम क्लियर टू यू. जो वैक्सीनेशन प्रोग्राम में रजिस्टर्ड होंगे सब वैक्सीन करेंगे, चाहे वो सेकंड जैब का इशू हो चाहे फर्स्ट जैब का इशू हो.
Okay, let me now bring in another panelist as well on this conversation. And Clyde, I want to start off with you. Clyde, we had a story over the weekend from the city where you and I live, where there was massive crowding at a vaccination center in Chembur in Mumbai. The gates had been locked and people were being told if you are not from this ward, you will not get the vaccine irrespective of the fact whether you've registered online or not. Then some people were given token numbers and sent inside, but again said that if you are not from this ward, you will have to wait to see if your turn comes and there is vaccine left, otherwise you go home. Now, what on ground, Clyde, if these are the kind of rules? We had another instance coming from Andheri where there was massive chaos that actually led to, almost a violent incidents happening there at the vaccination center. Because the system is chaotic. कहीं पे टोकन दे रहे हैं, कहीं पे ऑनलाइन कर रहे हैं, कहीं पे कह रहे हैं वार्ड के बेसिस पे मिलेगा. I should be able to go anywhere in this country and get my vaccine.
Absolutely, Tanvi. You should be able to go anywhere in this country and take your vaccination as long as you're a citizen of this country. Now, you spoke about that ward in Chembur. Well, if that one-off incident has happened, I completely condemn it. It's not acceptable, and I assure you, and it hasn't happened anywhere else. I mean, you're telling me about this, and I'm accepting because if you must have done your homework before you speak about this. So the fact of the matter is, something like this has happened, it's absolutely unacceptable. See, the fact of the matter is, chaos is happening. It is happening all across the country. Now, I'll tell you why this chaos is happening, and we've discussed this before also. It's because the center started saying that, we will supply vaccines to all the states. Then suddenly it declares 18 to 44 will be vaccinated. And then it suddenly goes on to declare that, now the states have to procure their own vaccines from the producers. Then we come to know that the central government has gone ahead and booked all the vaccines from the producers. So where will the state go? Where will it buy from? Where will it procure from? So this is the reason this confusion is happening, because the central government, like you said earlier, private hospitals and states, for a year, they were following what the central government guidelines were. And suddenly one fine morning, the central government says, like, abhi aap atmanirbhar ho. You do what, this is how it has to be done. So you can't just wake up one morning and start procuring the vaccines because the production is not there. The states have gone to the producing companies. They said, we have already given the stocks to the center. The stocks have been booked. The states are willing to pay, states are willing to buy, but there are no stocks. So whatever stock is there, you have to make do with that stocks. Then the question comes about senior citizens. Then the question comes about people above 45, people with comorbidities. So the local bodies, I mean, I'm not just talking about Mumbai or Maharashtra. I'm sure the other states also they're trying to, inoculate people are going through the same problem, because states from, run by the BJP government also, people have been complaining that we cannot inoculate the people because we don't have the stocks. We've been asking for the stocks. So it is a, complete mishandling or, kind of appropriation from the central government, where they've gone completely wrong. And when the central government suddenly realized that, we cannot handle this ourselves, so he's just palmed the whole thing onto each state, and the states now suddenly are grappling with this sudden load of, not having vaccine, then, trying to inoculate people. So we've been trying to do this systematically. And like you said, one or two incidents that have happened, I completely accept, and it's not acceptable. But at the same time, if you look at what is happening in Mumbai, I mean, everybody's talking about this right now, right from the Honorable Prime Minister of our country to the CEO of the Niti Aayog, to the Supreme Court. They've been talking about the Mumbai model. They've been talking about how Mumbai has handled everything, and we are doing it. We've started drive-in vaccinations. We have vaccination centers are coming up in every ward in the city. So everything is getting streamlined. Everything is systematic. But you have to understand that one fine morning, the central government, told us, wake up, good morning. Now it's all on your own. But despite all that, if you see, Mumbai and Maharashtra have been trying to get everything, put the pieces together, trying to get everything together, and we've been working hard. And as days go by, a little incident here and there happens because all of us are humans. But this thing is now getting systematic, and we are working on, like our health minister, Mr. Rajesh Tope, said that, we will only get a vaccine sometime in third week of May. And we are gearing up for that. We are preparing ourselves for that. And in the meantime, whatever stocks are available with us, we are systematically inoculating people. We are giving out to the people who have been registering, who've been, and let me add one more thing. The whole thing about the COVID app. I mean, half the time the COVID app doesn't even know what is happening. So our Chief Minister, Mr. Uddhav Thackeray, has written to the center asking that we have our own apps. Each state should have their own app. And again, I would like to redraw your attention that our party also, today Mr. Nawab Malik has gone ahead and said we need one nation, one policy. Let there be equal for everybody. It should be that my state, your state, you are a citizen of our country.
Clyde, you are saying that there are Clyde, but you say there are problems with the COVID portal, but we are the ones who are looking at a policy where everybody has to register online and no walk-in vaccinations. Then what do you expect the people to do when you come out with such rules?
So that's exactly what I'm trying to say. So since the app is not working properly and the people are suffering, we have one nation, one policy where everybody gets equal. And if that is not possible, then you allow us to have apps for each state so we can handle it, streamline it, let us less load on the server, less issues of confusion that is happening. So give us permission. We have to keep asking the central government, give us vaccines, give us remdesivir, give us oxygen, allow us to make sure that we have, a proper app. I mean, it's like begging. We've been Maharashtra, non-BJP states are begging to the center for everything. How does it work? We are one nation. We are all one. Why do we have to beg?
Let me ask.
These are our own people.
Okay. Let me ask this question to Charan Singh Sapra, and then maybe Amit Puri can also come in from the point of view of his state. But Charan Singh Sapra, are states ready to even handle what you will procure? A story today in Indian Express says that there are supply chain hurdles as well, because so far it was coming via centers, nodal center, establishments which were there. Will you be able to handle it in your states?
See, Tanvi, let me tell you that states are quite capable of handling the situation. But the major problem is that there is a policy paralysis with the central government. Now, we have been seeing this since many days, whether it is, the policy of beds, or whether oxygen, remdesivir, or this vaccination drive. There has been complete policy paralysis. Now, this government should have concentrated on 4 aspects as far as vaccination drive is concerned. That is production, procurement, pricing, and distribution. Now, if you see production, the production was not ramped up at an earlier stage. If you see pricing, they have gone in for differential pricing. So this differential pricing is definitely going to, lead towards profiteering and black marketing. As far as I feel the distribution is concerned, we have already seen that the central government has a discriminatory view as far as the distribution of these vaccines are concerned. We have seen an example where Maharashtra was given only 7 lakh vaccines, where we have a population of 13 crores, whereas Gujarat, which has a population of 6 crore, was discriminatory also. And moreover, this government has been delaying various decisions. Like Haskell Institute wanted to manufacture this vaccine. They had asked for a permission way back in December or January. They got permission in the last week of April. And also I would like to ask the central government why they want to hold the IPR, the intellectual property rights of Bharat Biotech. Why they are not distributing licenses. India is a pharmaceutical hub. It is known in the entire world. Now, a pharmaceutical hub is not able to produce as many vaccines which our population needs. This is, a very sorry state. And moreover, while 6.5 crore vaccines were sent abroad, to the 93 countries, and a report has now come that out of those 93 countries, 60% of the countries never needed it. They had a caseload which was very less than the caseload of India. So why not India first? This is a big question. The country or the party which always speaks or which always boasts about India first has left India behind. And now you have given this example of UP. Now, this very party always talks about one nation, one election, one nation, one tax. Then why these differential things in India? These are the question marks. There is a definite policy paralysis. This government is going nowhere. There is a complete chaos, confusion at the ground level just because central government doesn't have a clear-cut policy. They are changing the goalposts every day. That's why the state governments also get confused. If the state government gets confused,
Why do you say
the
they don't have a
municipal
clear-cut
corporation gets
policy?
confused.
I am reading right now from the reports that have come through about what the central government's answer and argument is to the Supreme Court on its vaccination policy, and they say it's a very well thought out, very well crafted policy that's been put into place. It's fair pricing, it's equitable distribution, multiple options which are available, and the supply will ensure that it goes on both sides. It goes on to say that we've decided to use the 45-year-old as the benchmark based on science and expert opinions. So why are you questioning it?
See, why I'm questioning it? Because there is a simple logic I'm giving you. 35,000 crores are kept on side for this vaccination drive. Why this government is not coming out clear and giving the nitty-gritty of those 35,000 crores? Why are not? Why, if they don't want to give us to the political parties or to the opposition parties, they can give that nitty-gritty to the Supreme Court also. They should come on record how they are going to use that 35,000 crores and what is the exact policy, what is the roadmap ahead. That's why I'm saying that there is a policy paralysis with the central government.
Okay, let me bring in our other panelists as well. Manojit Mandal of the TMC joins me right now. Mr. Manojit Mandal, the big challenge even for your state will be to ensure more and more people quickly get vaccinated as the infection spreads. Is your state prepared to do that in terms of your infrastructure?
In terms of our infrastructure, we are certainly prepared. But why do the vaccines come from? It's the same questions we have asked so far for 30 million doses, out of which we have got only today only 7 lakh. The fact remains that the government of India, again I tell you, government of India has no vaccine policy at all. And I want to understand how many meetings they had since the month of November when vaccines were more or less ready to be rolled out by December, January. How many meetings they had with the state government regarding the vaccine policy? Can you remember any meetings being held with the state government? The answer is simply no. They had to take, they wanted to take the entire credit of vaccination. And in the month of January, you see, the government was talking about the fact that the world should look at us, how we are fighting COVID, that was the kind of preparedness that we had. And even in the month of January itself, you had the first super spreader event in the form of inauguration of Mr. Narendra Modi Stadium in Gujarat, where people were watching cricket match. That's the kind of preparedness we are talking about. Even now I tell you, the people who are vaccinated, they might need vaccination again after 6-7 months. Where are we going to get the vaccines from? The people like me who have got the 2 doses by middle of April, I may need it in the month of December, January. And by the time even 10% of the population will not be vaccinated. So this would be a hell lot of problem, I tell you. Unless and until still the government needs to ramp up by infusing money. One of the panelists were talking about 35,000 crores in the budget. What is the money? They should pump it in the companies to ramp the production. That's what they are saying. You are giving only 3,000 crores or 4,000 crores. That's not going to happen. That's not going to bring the vaccines for all of us. Forget about the policy, pricing, and so on and so forth. I think that the complete, total lack of any policy as far as the vaccination is concerned. And now, at this point in time, when things are completely out of control, you are saying that the public health is a state policy. We know it. We knew it from the beginning that public health is a state policy. But you were sending teams to our government selectively. Now send teams. Now we need your help. Now we need your advice. Now we need the vaccines. You are completely silent. The government has to take the plunge. Government has to take the blame as well. Because you are the father, you are the central government. And we are like your sons and daughters. You have to cater to our needs. You have to give us remdesivir, oxygen. These are state government cannot procure them. State
No,
government
but
cannot
here is
produce
the
them.
point, Mr. Manojit
Everyone knows
Mandal. It's okay to make all of these statements, but the central government's response has been, and the BJP's response always has been, well, the states wanted more control. The states said, give us more control. The states said, open it up to everybody. So we've opened it up to more people, and we've given you the responsibility of doing it. Now, why are you blaming the center?
No. Vaccine production or oxygen production are never the state domains, I tell you. Yeah, we wanted control as far as fighting COVID on the ground.
Tanvi,
Like, deciding on the lockdown,
Can I-
the local areas, containment zone, and so on and so forth. We certainly wanted control, and we are happy about that. As government at least now realize. Like, I'm giving an example of how we are going it. In our state, there are 5 districts where there are no cases. So we are not having any kind of lockdown in those 5 districts. Sorry, not the state, 5 districts. But still we need the central government's help in terms of vaccination. Otherwise, it's not possible for the state government to fight the case
Okay.
at all. And again, what will happen after 6 months? People are still
Okay.
thinking about third wave. What will happen 6 months down the line? The state and the center now need complete
Well,
coordination.
I think you are in power.
consultation.
You may have been busy last few months with elections, Manojit Mandal, but what happens for the third wave is also the state's responsibility to prepare. Put up your own oxygen plants, put up your own hospital centers, set your own helplines
we
and
can't do
testing
this.
centers in
Tanvi,
order.
we
You will
can't
be
do
also better
this.
prepared. You should learn your lesson to not depend on anybody, even if it is the central government right now. Clyde Crasto wanted to make a point. Clyde, go ahead, please.
Tanvi, you just mentioned that the states asked for opening up the age of vaccination, and the central government did it, and then now we are complaining. The fact of the matter is, yes, the states did ask to open up the age limit, but at that point of time, it was always the center who had made assurances to the states that we will provide you with the vaccines. Then after they opened it up, suddenly one fine morning, like I mentioned earlier, they said, now you got to procure it. I mean, it got us out of the blue completely. Took us, completely out of the blue. It arrived from nowhere. That's what the problem is. And also, the fact of the matter is, if the Supreme Court has appointed a 12-member panel as a COVID task force, it just shows that even the highest body, the apex body of the judiciary, is not happy with the kind of work that the government is doing. Therefore, they have made a panel of 12 people. That's what is happening. So the fact of the matter is, everywhere it has just been politicizing of the whole issue. We had to come together. The honorable prime minister says come together and fight this pandemic together, but the local BJP leaders, I'll give you an example of Maharashtra. I mean, every day they come up with something new, then they fall flat on their face. We prove them wrong, with all the statistics and figures, and they come up with something else. But the fact is, there are people who are in the highest places, who have the knowledge and understanding, have been saying that, listen, follow this model. Follow what Maharashtra has done. Follow what Mumbai is doing. No, they have their own agenda, playing politics all the time. I'll give you a very small example. One of the BJP leaders here in Maharashtra, when there was an oxygen leak that happened, there was a technical problem that happened in Nashik. And he went on, the government has failed, government has this, government has that. He was on air while talking. And suddenly, the reporter reminded him, said, listen, the Nashik municipality has been run by the BJP. So what are you talking about? If you're talking about the administration failure, you're talking about your own failure. That he completely turned around, got upset with the journalists, and he started blaming the journalists for asking wrong question. The fact is, you are only wanting to malign people without even having the facts together. My point here is, don't malign, don't say anything, come together.
Okay.
Let's fight this pandemic together. Why do you want to politicize this whole issue?
Okay.
We are suffering, the people are suffering. Come together and
Let me ask, Doctor. Okay. Okay, let me also ask Amit Puri this question about the centre's vaccine policy before we go to our 2 doctors and the experts on the panel as well. But Amit Puri, you've heard the Congress, the NCP and the TMC. Do you agree that there is some change which is required, or do you think this is just the opposition which has a problem?
I mean, I was expecting little more prudentness and Team India approach from my opponents. rather than scoring brownie points at this juncture also. But the saddest part is everyone non-BJP party, first they allege that this vaccine is a Modi Yogi vaccine or a BJP vaccine, we will not get the jab. Now the jib is at best. Now they are making a number of issues. I'm not going into the nitty-gritties of the local political commentary which they have referred. But the entire vaccination policy is before the Supreme Court, and the executive decision is before the Supreme Court. कॉन्स्टिट्यूशन भी कहता है कि डिसीजन मेकिंग की एग्जीक्यूटिव पॉलिसी स्टेट का सब्जेक्ट है, नॉन डिस्क्रिमिनेटरी होनी चाहिए, कलरेबल एक्सरसाइज ऑफ पावर नहीं होनी चाहिए. लेट द सुप्रीम कोर्ट पोर इट्स माइंड ओवर इट. We will abide by the decision of the Supreme Court. So far as my side is concerned, we have made a country's approach as a unified one. Prime Minister has taken on board the entire set of chief ministers, and the consensus was evolved on this policy issue. They wanted freedom. They wanted state liberty. They wanted autonomy on the state side to decide on the certain issues of pandemic. Now, once that decision has been taken, they are taking a reverse turn on it just because of the political reasons. I fail to understand. एक दिन ये मोदी योगी की वैक्सीन है, बीजेपी की वैक्सीन है, और आज हम नहीं लगवाएंगे, और आज ये हो रहा है कि वैक्सीन क्यों नहीं. मैं अभी बिजनेस स्टैंडर्ड को देख रहा था. बिजनेस स्टैंडर्ड ने कहा 5 मिलियन डोजेस जो है यूपी गवर्नमेंट ने के पास आई है, चाहे वो कोवैक्सीन की हो चाहे कोविशील्ड की हो. हमने ग्लोबल टेंडर्स फ्लोट किए हैं. यही बात बाकी की स्टेट गवर्नमेंट्स भी कर सकती हैं. तब तो वो लिबर्टी चाहती थी. तब कहते थे पैंडेमिक एक्ट के अंदर मोदी की गवर्नमेंट जो है ये ऑटोक्रेटिक हो गई है स्टेट फेडरल स्ट्रक्चर से. अब फिर सेंट्रलाइज्ड स्ट्रक्चर ठीक लगने लगा क्योंकि दे आर अनेबल टू कंट्रोल द थिंग्स ऑन देयर ओन पार्ट.
No, can I come in?
इमरजेंसी
Okay, okay.
इनिशियल स्टेज की इमरजेंसी प्राइसिंग की गई थी.
Okay. Yes. 30 seconds to Clyde to respond on this before I go to my experts, because I want to get back on the policy. But yes, Clyde.
No, the BJP spokesperson was talking about prudency. Okay, there are a couple of things, and I'll say it quickly in 30 seconds, like you told me. There are two things that I want to say. What happened to your prudency when, like Mr. Sapra said earlier, when you see the caseload of a state, okay, and you see the population of a state, when Maharashtra has a population of 12 crore people, you give them 7 lakh vaccines. When Gujarat has a population of 6 crore people, you give them 30 to 40 lakh vaccines. But what happens to your prudency during those times? Sir, I was not talking when you were talking. So have the decency to be quiet, sir. Sir, have the decency to be quiet. Whenever you were talking, I was not talking.
1 minute, please. Mr. Puri, let him finish.
Please be quiet.
Mr. Puri, let him finish, please. Yes.
One more thing, Tanvi. Tanvi, one more thing, let me tell you. Like what he's trying to say is that suddenly now we are finding the central policy correct. No, we are not finding the central policy correct. We are still saying that allow us to do certain things. But you can't just wake up one morning and say, ab karo. Okay, you can't say ab karo. And we are still asking.
Well, let me just point out this fact.
For certain things. And we have to keep asking because they're not allowing us to do it. That's the whole point. We are ready. We are ready to do highest number of vaccinations.
Well, let me just point out this fact. That even in Uttar Pradesh, where they seem to be extremely satisfied with the stocks which are coming in and what they themselves, the state may have managed to order and bring in from the vaccine makers, Uttar Pradesh has also seen a drop of 58% in its vaccination pace since the first week of April. एक महीने में जहां पॉलिसी खुल गई है और लोग एलिजिबल हो गए हैं, the drop in pace of vaccination is 58% even for Uttar Pradesh. For most of the states is that bad. From Maharashtra to Chhattisgarh to Gujarat to Uttar Pradesh, this is the situation, and this is not because governments have lost interest in vaccinating people. It is because this is the level of doses you are getting from your suppliers, whether your suppliers are the central government or directly the vaccine makers. This is the reality of our country today. Add to that, when orders come, which Amit Puri says was just bad choice of words, but when orders are issued, they actually bring in the domicile aspect in written. Imagine what could have happened. Imagine the confusion on ground. Imagine those thousands and lakhs of migrant workers who are working across different states away from those homes. Imagine those people who are currently out for work for traveling for work or are away from their families, stuck in different parts of the country because of lockdown, because they're stuck in one place. What would have happened there? It is these kind of even mistakes that could become extremely costly for us. Now, Amit Puri and the UP government may have clarified that there is obviously no restriction. It couldn't have been. States cannot come up with this policy. Otherwise, tomorrow, every state will stand up and say, we will only vaccinate our own people. And that's dangerous. Let me also say good evening to Dr. Swaminathan, who is joining us on this conversation. Dr. Swaminathan, to your mind, is there a policy issue with our vaccination drive that is slowing us down as well? The government seems to have, put out a very well-crafted defense, given it to the court to say, no, we stand by this policy. There is nothing wrong with it. Do we need to make changes to improve our vaccination drive?
I'm looking at the upside of this. For the first time, I see everybody on every side of the aisle saying that the vaccination drive is absolutely critical. I'm happy to see there is unison in that. We have had differences of opinion on the pace and who and whatnot. And for the first time, everybody is shouting, saying, let's vaccinate, let's vaccinate. To me, that itself is the first victory that I would think of. So you know what? Thank God for that. The second thing is that the medical community and many of us have been pointing out that the vaccination drive needs to go out much faster about 3 months ago. And unfortunately, we didn't see this kind of speed or fire at that time. I wish we had seen it at that time. I wish people had listened to the medical community, the experts in epidemiology and public health saying we need to move faster. Number 3, even today, I'm seeing rhetoric. I'm not going to say who's right, who's wrong. That's not my job. I'm still not seeing good analysis on where our supply chain bottlenecks are. We are all saying there's not enough doses. Correct. Okay. But why is that so? We are the world's vaccine basket. Why is there a bottleneck? Is it a problem in raw materials? Is it a problem in not enough having enough, factories? What is it? Why can't we upscale it? Why can't we have one factory in every state, pumping out these vaccines? Why don't we have solutions like that? Why don't we talk about that? Yes, we've all made mistakes. All of us are equally responsible for this. I don't think this blame game is taking us anywhere. The people are tired of this. It's really difficult times. We all agree that. I don't want to indulge in this blame game.
Let me ask you this. And I am asking you in terms of, right, and I'm asking you in terms of, the need that everybody agrees on, the need to speed up the vaccination pace. Now, bringing in new players at this time, would that be a prudent thing to do? Do the private hospitals, for example, have that kind of a bandwidth to arrange for their own vaccines, the transport, the logistics, the cold chain storage of those vaccines, to be able to actually give it to people?
I'm actually against hospitals being involved in this. See, already hospitals are overrun, and taking people out of COVID care, it doesn't make sense. Put it out in the public sector. Let it be retired hospital employees, community health workers, put it in stadiums, put it in airports, put it in railway stations, put it there and do the vaccine. You need all hands on deck in the healthcare system. We have too many patients and not enough staff. So please don't have vaccine centers in the hospitals. I'm dead against that. And you're mixing healthy people and COVID people in the same tinderbox. How is that a bright idea? I'm sorry, I just don't see the logic in it. 3 months ago, when COVID numbers were low, I saw the logic in it. Now I'm actually screaming, saying, please don't mix these two together. It's a bad idea. Please take it out of private healthcare, put it in the public sector, put it in open areas, and do it in a mass vaccination campaign, which has been done in the Western world. And let all the healthcare workers in the private hospitals and in the government hospitals work on COVID patients. We need more people. We are all agreeing on that. But at the same time, we are still using the same channels to distribute the vaccine. Let's not do that. And as far as the logistics of this is concerned, I think it can be done. We do have healthcare workers who are not officially trained healthcare workers already involved in healthcare, whether it's a part-time community healthcare worker or so many other community level workers involved in this. So why not involve them in the vaccination maneuver and jettison it so that it stays by itself? Let's keep this as two separate arms to prevent mixing of patients and unnecessary transmission risks.
Okay, fair enough. Very quickly, I want to bring in Dr. Jayalal also on this and ask him the same question as well. And I'm talking about this, Dr. Jayalal, because we've seen examples where states have not been able to procure their vaccines yet and will only get a bulk of their order much later. but some of the private hospitals have managed to get it and are vaccinating people. Is that equitable distribution? Because hospitals are obviously charging you a higher price.
Yeah, absolutely. I'm really pained to see that even in this pandemic, when thousands of people are dying and crying for the oxygen, crying for the life, and we are still fighting and we are trying to put the blame on each other and trying to escape from the real crutch of the issue. Success has many fathers, but failure is an orphan. And today it is a total failure of the policy. Say that the policy of the government saying the discriminatory pricing and giving the right to the individual private practitioners and the hospital to procure the medicine is a non-palpable and non-practicable policy. And with this policy in turn, definitely we will not be able to do the universal vaccination. And we need to come out with a scheme where that everyone has an opportunity to get the vaccination, whether inside the hospital, outside the hospital. We have enough manpower to see to that the vaccination drive is there. The only problem is the source is not there. We have enough opportunities. There are a lot of vaccination centers, including in Tamil Nadu, there is a center built in the cost of 900 crores. It is yet not open. They have the capacity to produce 530 million of vaccine if you give the proprietary right, if you give the mechanism. It is an Indian pride. Biotech vaccination is an Indian pride. Why we are not sharing with other companies to produce the vaccine? There is a lot of means and ways to uphill our task, uphill our souls, and augment the source of the vaccination. But we are absolutely failing. We are trying to say whether the center is right or the state is right. And that is going to lead us to a disastrous situation. Let us forget about that. But a country needs vaccination. The India should be vaccinated to get out of this COVID pandemic. So let us forget about this. But policy, let us come together, sit together, talk with all the stakeholders and discuss with them and come out with the policy. Let the Indian government take the responsibility to ensure that universal vaccination is able to reach them in an equitable, affordable and accessible way. And if they are going to have the policy of the discriminatory pricing and differential pricing, I'm sure that we are at fault. So on behalf of Indian Medical Association, I will put it in record. The policy of the vaccination is at fault.
No, and we were looking at the math of how much of funds will it need for individual states to now pay up for it. And we were looking at, the population 18 to 44, how many vaccines that the states have already ordered. Most of them have declared how much of Covaxin, how much of Covishield they have ordered. And if you do the math, in many cases, it goes up to 30% of their budget in altogether. Now, that's going to be a big one for the states to manage. So, Amit Puri, I don't understand. The center's argument is that we are getting a lower price and then the state governments, because we struck this deal earlier when the vaccine makers were going through a difficult phase than now. And we are going to get it in bulk. We have made a larger bulk order, which is why we are getting it at a low price. If that is the case, why not put the entire order from the central government side at a lower price and then give it off to the state governments?
Strike a deal, right? You are a state. You don't try to strike a deal with a company.
Manojit Mandal, I will come to you. I know you have a point to make on this, but let Amit Puri answer my question first. Why shouldn't the center at that lower price order it for the entire population, then give it up to the states and let them distribute it?
दानवी इनिशियल स्टेज में जो प्राइसिंग थी वो इमरजेंसी प्राइसिंग थी और उस इमरजेंसी प्राइसिंग को निगोशिएट किया गया और बेस्ट डील को स्ट्राइक किया गया आज की तारीख में। और आज की तारीख में सेंटर ने अपने फंड्स को जो रिलीज करना था वो अपने फंड्स को जो बजटरी एक्सपेंडिचर के अंदर प्रोवाइड किए थे 35,000 करोड़ के, उसका हम मैक्सिमम यूज कर रहे हैं। और स्टेट के अंदर भी अलग अलग स्टेट्स के अपने सोर्सेज से भी हम मोबिलाइज कर रहे हैं सो दैट कि फास्टर पेस के ऊपर वैक्सीनेशन का प्रोसेस स्टार्ट करे और अल्टीमेट एंड तक वो पहुंचे, यानी आम आदमी तक, वो लास्ट आदमी तक पहुंचने की कोशिश करें। इस पूरे इश्यू के अंदर जो भी पॉलिसी एडमिनिस्ट्रेटिव ने बनाई है, जैसा मैं दो एक्सपर्ट्स को सुन रहा था कि नॉन डिस्क्रिमिनेटरी होनी चाहिए, अफोर्डेबल होनी चाहिए, इक्विटेबल होनी चाहिए, इन तीन बेसिक पैरामीटर्स के ऊपर हमने पॉलिसी को फ्रेम आउट किया है। अब वो जुडिशियल स्क्रूटनी के अंदर है, गवर्नमेंट का एफिडेविट सुप्रीम कोर्ट के सामने है। लेट दिस सुप्रीम कोर्ट पोर इट्स माइंड एंड कम आउट विद इट्स व्यूज।
Okay, Manojit Mandal wanted to make a point. Go ahead, please.
How does it become equitable? when you are having different prices for the state and the center, so how does it become equitable? I don't understand. You are buying it at 150, you're giving it as 300 rupees
I
now.
think it's
Earlier it was
equitable for the
400.
people because all state governments have announced that the vaccines will be free.
But the
It's
state
equitable for the
is
people
also
because
consist
all
of
states
people.
have announced it will be free.
But the state has to buy it from the center and the company. Even that's not the point. I mean, that is one part of the story. Even
No, but even
we are
the
trying to buy it
center
from
can
our
regulate the
own
price, not
coffer.
the company.
Are we getting it in enough number? That is the answer. There lies the problem of the central government, because they, instead of brokering a deal with the company, they should have asked them to ramp up production in the month of November. Even if we want to buy it
Initially,
from
you
our own
people wanted
coffer,
it.
we
State
cannot.
autonomy on
We
this subject.
like we have. Please don't disturb. We
Now
have
don't take it
ordered
to
as of
initially
now
you people
30
wanted it.
million doses from Serum Institute. We are not getting the vaccines in number, even if we want to buy it, because it was the center's decision to have these productions and have a kind of deal with both the companies. And again, I repeat my point, which I did long time back. Bharat Biotech, we had a joint venture with Bharat Biotech where we have already invested some money. That is a public money. Why they are charging so much of money, 1200 rupees, 600 rupees? What is this?
Tanvi,
We have already
Tanvi.
invested money. That is a
Tanvi,
public
Okay.
money.
Tanvi, can
With
I
the
come in?
Yes, yes,
Can I
Clyde.
Yeah, Tanvi, every time.
Yes, one at a time. Clyde first, and then we'll go to Mr. Sapra.
No, Tanvi, every time one of us from the opposition says something, the BJP spokesperson goes on to say that you asked for it, so take it. You said this, so take it. So are you trying to say that we've extended our hand and we're trying to do something, so you're trying to punish us? आपने ये पूछ लिया तो अभी आप भोगत लो. आपके सर पे है जो भी है. I mean, it can't be like this. So what Abhijit
नहीं,
Manda
अब
was
नवाब
saying was
मलिक
right.
साहब को
At
इस
the end
वैक्सीन पे यकीन है?
No, hello, please.
एनसीपी के
आप थोड़ा सा
स्पोक्सपर्सन बस
decency
बताएं
रखिए.
क्या?
आपसे
आज ये
अपेक्षा है
वैक्सीन
थोड़ा
बहुत
decency
अच्छी हो
की.
गई
मैं
और
बात कर रहा था
शुरुआत में
जब
एनसीपी के
आप बात कर रहे थे जब
नवाब
मेरे बीच
मलिक
में बात
साहब
नहीं
को
की
ये
तो
वैक्सीन मोदी
थोड़ा
की
डिसेंसी
वैक्सीन
रखिए
लगती थी।
साहब. थोड़ी
मैं
डिसेंसी
डिसेंसी के साथ
आप
पूछ
जब
रहा हूँ,
बात कर रहे थे
आज
तो
ये
मैं भी बात
वैक्सीन
कर
अच्छी
रहा
है।
था. तन्वी, can you
मुझे
keep
कुछ
a
समझ
minute
नहीं
out
आ
of
रहा.
minute
मुझे
of
एक
talking,
मिनट
please?
कुछ समझ नहीं आ रहा. I can't
Tanvi,
hear
can I
or
come in?
understand anybody. Please, one at a time, please.
You asked me to
Yes,
talk,
yes,
Tanvi.
yes.
Stop
Clyde,
talking.
finish, and then I'll go to the others quickly. Yes.
Yeah. So
Yes.
my point is very simple. At the end of the day, it should have been equal pricing, because if the center was doing it, it was at a lesser price. If the state is going to do it, it's at a higher price. But at the end of the day, exchequer is paying. It's the people who end up paying. It's their money. So why
Yeah,
the difference?
and I'm just saying that if the argument is that the center is getting a lower price because they have ordered large volumes, then it would have been just prudent to order larger volumes for the entire nation, give it off to the states, take the money from the states for that price if required, if you want them to pitch in with the money part. Yes, yes, yes. Charan Singh Sapra, please, go ahead.
Tanvi, one thing is very clear, that everybody in this nation
Correct.
is understanding that there should
Yes.
be a uniform pricing policy. And everybody in this country wants a uniform pricing policy. But Modi government is not ready to understand that. I feel the ego of this Modi government, it's coming into the way. And secondly, we have been very late in this. You see at US had planned this way back in August 2020 when they invested 44,700 crores into this vaccination process. They had ordered around 400 million doses in September 2020. UK had ordered 150 million doses in September 2020. Even the European Union, they had ordered around 800 million doses between the span of August to October 2020. And when did India order? 60 million doses, that also in the last week of April. So we are lagging behind. We have not planned it decently. And this is why there is
we
a
are
situation
lagging
at the
behind,
ground. There is a
and we are
complete
lagging
chaos.
behind, and I hope something constructive actually comes out of this whole conversation which is going on in the courts now about the vaccination policy, irrespective of what the center wants us to believe. Very quickly, I have one question for Dr. Swaminathan before I wrap this up. Dr. Swaminathan, there are now big concerns emerging about the double mutant right now. I think, and news is also coming about the WHO now labeling coronavirus strain in India as a variant of concern. Basis the two vaccines that we have, obviously too soon for us to say whether or not they will be effective, but the way they were researched and developed, does it look like they may be effective, or is there a concern there as well?
Let me put it like this. See, while we are all concerned about this particular variant, it's only a question of time before we have more variants coming through. That should not deter us from the importance of the vaccine campaign. And remember, you are trying to hit a moving target, and therefore some misses are likely. Overall, I do expect that the vaccine will be partially protective. Very simply put, when I look at my elderly patients who have taken the vaccine, very, very, very few of them get severe disease. And let's look at the mortality with regards to COVID in patients who have had 2 doses of vaccine. Very rare even today. So for that reason, I would suspect that the vaccine does preserve its efficacy against all the mutants that we are looking at right now. Whether it will hold true in the future or not, nobody can say. But I don't think there's any reason for us to get too enamored with this variant of concern. But we should still continue focusing on the basics and obviously keep harping again and again on vaccination.
Yes, no, absolutely. I think vaccination, there is no denying the fact, is one of the biggest tools we have right now to arm ourselves with in our fight against COVID. We need more and more vaccines. We need the governments to work together. We need the governments to move quickly to bringing us more vaccine options. Just announcing that you're going to be issuing global tenders from one state or the other is not going to help us at all. We need clarity on what's happening to the next stock, which may be kind of coming in from Sputnik. We need clarity on what is being manufactured by Serum Institute and Bharat Biotech, and how is it going between states, central government and the private hospitals. We need clarity on why and how much of stepping up of the Bharat Biotech or co-vaccine production can we do with other partners. It's an Indian developed vaccine in collaboration with ICMR. More partners are being brought in to increase and ramp up the production facility. When is that going to happen? Why don't we make all of these facts very clear and out there? We need one consolidated comprehensive vaccination policy which doesn't change on ground day-to-day basis from one state to the other, from one city to the other, from one civic body ward to the other civic body ward. It cannot happen. All of this is what is slowing down our vaccination process at a time when the pace of infection is only rising. Out of time. Thank you so much for joining us on this conversation. Thank you to our guests.